If I speak of myself, I have at least two hats. One is the academic hat, as many of us, and obviously from an academic point of view, we are very happy for these changes, and we are witnessing always more the interaction between the laboratory and the clinic. It is a daily activity. So translation research, we see it applied. In the old days, when I was young, it took years to translate. Now we translate very rapidly. So with an academic hat, it's a major step forward, a major advancement, and a great benefit to patients. I mean, obviously we lose many patients, but many more live, and they live longer. So this is a major shift. Even the elderly, I mean, that's something we could discuss, because in our countries, the median age is developing and increasing always more. I live and work in Italy, and Italy is just about the most longevic country. We are only second to Japan, more or less. So living longer and having less kids, so there are many elderly people, this is a major step forward. But what you bring up is the issue of, I would say, of sustainability and even accessibility. And I have a second hat, which is maybe my EHA hat, where I chair the education committee and the outreach unit. So we do events everywhere in the world, education. And it's very clear that the world is very different. I mean, and I would say that the fork between lucky countries and the less lucky is becoming enormous. So in many parts of the world, treatment is not, or let's say the newer drugs and technologies to make diagnosis are not really available unless you're wealthy. So if you can pay for the drugs, the technologies, all this, then you can do it, whether it's in your country or whether by buying abroad or going abroad. But the normal people, which obviously are the large majority, don't get access to the new drugs. So new drugs and new technology. So this is a major challenge. Obviously, it's hard for us to change this. This is a political issue, and something will have to be done, I think. Clearly, there are some changes. I mean, we all know biosimilars, which are not the originators, but they are really the same, and that obviously a step forward with a saving. Then there are some homemade drugs. I mean, many countries are leading the way to drugs made in-house, which are maybe less controlled than a real biosimilar. But better than nothing, you're having something that is partially functioning. So this is happening in many parts of the world, having this homemade drug. So the ways to try to overcome this, but it is a key point, and the inequality of this is getting bigger, not smaller.